Rafe here from Vet Triage. It is Sunday, January 19, 7:33 a.m. Pacific time, and we are on the very last, the last article for this October 2024 edition of Veterinary Surgery. So tomorrow we'll start a whole new journal. We are going to be talking about the use of a sling suture for ventral orbital stabilization after inferior orbitectomy in 3 dogs. And this study comes out of the UK and South Africa. And so in the pictures below, this is not what this case is about, but that is a tumor, an uncommon tumor that affects the skull of dogs. And you can see how dramatic it is in that dog. And then on the other picture is a CAT scan image, and you can see that explosion, what looks like an explosion on the top of the skull there, and that's what's called a multi-lobar tumor of bone, or MLO. So that's what that looks like, and that is a tumor that's removed with this surgical technique, although different location. This what you're seeing in the picture is the top of the skull. The objective is to describe a novel surgical technique for the ventral stabilization of the orbit and after inferior orbitectomy by using a sling suture, and report the outcome in 3 dogs. All dogs presented with caudal unilateral maxillary masses. Surgical resection required a caudal maxillectomy and inferior orbitectomy with a combined dorsolateral and intraoral approach. A sling suture was used to support the globe. The nylon suture was passed rostrally through the osteomized maxilla and caudally through the osteomized zygomatic arch via pre-drilled holes. This will make more sense once I show you some pictures here in a minute. The suture was tightened until the position of the globe was subjectively normal and secured with surgeon's knot. The periorbital was secured over the nylon suture with polyglycaprone suture material in a simple interrupted or continuous pattern. Follow-up ranged from 7 to 63 days. Healing was uneventful, no post-op complications, no orbital deviation, and the zygomatic regions appeared symmetric. Introduction. The most common oral tumors in dogs are malignant melanoma, squamous cell carcinoma, and fibrosarcoma. And you're going to want to know that as vet students as well as interns and residents. Periorbital tumors include multilobular tumor of bone, which is the MLO, that's right there, the osteosarcoma, squamous cell carcinoma, and fibrosarcoma. Wide surgical excision is recommended for oral tumors, which in the case of periorbital and caudally located oral tumors may require a caudal maxillectomy and a partial orbitectomy to achieve margins. A partial orbitectomy involves a superior or inferior orbitectomy. The globe is preserved with partial orbitectomy if not invaded by tumor. In contrast, a total orbitectomy requires enucleation. The orbit includes the globe, muscles, nerves, vessels, glands, and fascia. The orbit and the zygomatic arch provide stability and protection to these structures. As a result, orbital instability can occur following partial orbitectomies, leading to complications including strabismus, blindness, conjunctivitis, infection, and neurologic signs if a craniotomy is performed. Furthermore, traumatic uveitis, globe rupture, retinal detachment, and ophthalmos, epiphora, zygomatic duct or gland damage, and altered cosmetics, depending on the degree of iatrogenic trauma. It is reported these complications are functionally and cosmetically mild, and orbital stabilization is rarely indicated. In veterinary medicine, temporalis muscle flap, temporalis fascia transposition flap, masseter muscle flap, plate reconstruction, and orthopedic wire covered with polypropylene mesh and a collagen sheet have been used to reconstruct the ventral orbital rim and stabilize the globe after an orbitectomy. So that you want to know as a surgery resident. And what they're saying here is basically they're trying to find ways to support the under part of the eye if you have to remove the entire cheekbone because of a tumor. That's the entire paper. Experimentally, the canine zygomatic defects can be successfully repaired with 3-dimensional printed tissue engineered constructs derived from culturing autogenous bone marrow stromal cells on beta tricalcium phosphate scaffolds. In that study, synostosis was evident between the osteomized orbital rim edges and the induced beta tricalcium phosphate scaffolding with the autologous bone marrow stromal cells by 12 weeks after reconstruction. More recently, zygomatic arch reconstruction was performed on a dog with 3D printed polycaprolactone / beta tricalcium phosphate scaffold. All of the techniques require extensive dissection and exposure, and implants can increase anesthetic and surgical times, cost, and risk of morbidity. Materials and methods. The dogs were positioned in lateral recumbency with the effective side of the maxilla uppermost. No regional nerve blocks were performed to prevent seeding of neoplastic cells. The intraoral incision was planned based on CT scan findings and the visual soft tissue lesion to achieve at least 10 millimeters margin around the gross lesion. I'm going to say right off the bat that when they say here no regional nerve blocks were performed to prevent seeding of neoplastic cells, from writing my own research papers, I'm surprised that they didn't make the authors cite where they got that from, because if that's a hypothetical, it should be stated. If that's been shown to be true, or at least there's evidence to support that, then that should have been cited, and it's not cited in here. 10 millimeter margins is pretty good, considering the location of these tumors. Depending on the dog, the appropriate dorsal, rostral, caudal, and ventral osteotomies were performed with a size 4, 1.4 millimeter diameter round handpiece, tungsten carbide burr mounted on electrical drill to complete the planned caudal maxillectomy. Following the resection, 2 holes are created to pass the sling suture. They use a nylon ethicon from the UK, size 0 suture material in 2 dogs, or nylon size 2.0 in 1 dog, inserted through the pre-drilled holes and situated ventral to the globe to support it. A second loop was inserted as necessary to support the orbit. Dogs were discharged with some combination of Clabomox or cephalexin, and for pain meds, carprofen, meloxicam, paracetamol, and gabapentin, combination thereof. So here is CT scans, and you can see there with the asterisks, they're showing you where the tumor is in these dogs. Here's another one again where they're showing you with the asterisks where the tumor is. That's the area of the body that we're talking about. So it's a very difficult area to approach. Results. The diagnosis in these 3 dogs include a completely excised high-grade osteosarcoma, an incompletely excised osteosarcoma, and a completely excised high-grade sarcoma with the morphologic features and growth patterns of a malignant peripheral nerve sheath tumor. Here is a drawing of the procedure, and this is when I understood what they were doing there. So you can see in A is a normal skull. In B, they're showing you where they're going to cut, and then in C, they show you the missing portion of the skull now, and you can see that the underside of the orbit is not supported. Then for D, they're showing you where they drill 2 small holes where on both ends of where the zygomatic arch used to be. And then for E, you see the sling there, and then F is the finished product. And then here is the surgery view. Unfortunately, they didn't tell you where's cranial, caudal, dorsal, or ventral, but hopefully you can make out the dog's muzzle, the nose there, and then the eye, and then the last picture there shows the end result there of what they're doing. So, all right, discussion. A nylon sling suture was placed through the pre-drilled holes from the caudal maxilla to the rostral segment of the zygomatic arch to mimic the resected zygomatic arch. The suture was tightened as needed to hold the globe in a normal position, and then the periorbital was wrapped around the sling to secured with a continuous suture pattern. Some of the complications of inferior orbitectomies include anophthalmos, strabismus, blindness, epiphora, altered cosmetic appearance, and dystopia. Dystopia is derived from the Greek words dys and topos, meaning bad place, meaning that something is not in the correct position. In the case of ocular dystopia, it means that the globes are not positioned in the same height. In people, diplopia, which is double vision, is also reported. In people, facial reconstruction following maxillectomy is performed with soft tissue and bone flaps, bone grafts combined with a soft tissue flap, free vascularized soft tissue flaps alone, or free vascularized pedicled composite flaps with bone, or a combination of soft tissue flaps with prosthesis. The main drawbacks of autologous bone grafts are donor site morbidity, increased surgery time, inability to contour easily, and unpredictability in resorption, which alters the cosmetics. There are less resistant to infection as well following radiotherapy. Free vascularized soft tissue and composite flaps are commonly used for orbital reconstructions in people due to their direct blood supply, superiority to withstand radiation, and provide reliable and permanent support to the globe. However, their disadvantages lie in the muscles they consist of, which can atrophy, leading to loss of volume and alter the aesthetic effect. Three-dimensional printed titanium mesh has been shown in conjunction with free or pedicle muscle flaps. This provides better precision of the reconstruction, but it's costly, has a risk of corrosion, ion reaction, and exposure following radiotherapy. Veterinary techniques include temporalis muscle flap, temporalis fascia transposition flap, masseter muscle flap, and plate reconstruction, patient-specific implants, and orthopedic wire covered with polypropylene mesh and a collagen sheet. Those are, all things we want to know for surgery boards. A temporalis muscle flap has been used to treat a dog with orbital nasal fistula from zygomatic arch resection for a zygomatic adenocarcinoma. Complications were pain and mastication, facial and trigeminal nerve injury. Another report had a temporalis fascia transposition flap for orbital reconstruction after an inferior orbitectomy, and they found mild epiphora and minimal ventral deviation of the globe. Further extension of the surgical incision is necessary to create the temporalis fascia flap, which could increase surgery time and morbidity. The authors suggest that using a fascia rather than a muscular flap could prevent the aesthetic changes from the muscle atrophy. A masseter muscle flap with preservation of the periosteum over the dorsal zygomatic arch to suture the flap has been described. Bone formation was seen 8 months post-op. Disadvantages include infiltration by cancer, and it's not always the masseter muscle is not always available for reconstruction. The use of an autologous tissue for orbital reconstruction has the advantage of not using foreign material and the absence of implant-related complications and reactions. They do increase the dissection and surgery time, have the potential for donor site morbidity, and can cause tumor seeding. Resorption of the autologous tissues, altered cosmetics, and increased infection may also be more common in people receiving adjuvant radiotherapy. Orthopedic wire covered first with a polypropylene mesh and then collagen sheet has been reported to reconstruct the orbital rim in 4 dogs and a cat. 3.5 millimeter reconstruction plate was used with orthopedic wire. Cerclage wire with or without polypropylene mesh has also been reported for zygomatic defects following caudal maxillectomy and zygomatic arch resection. The experimental reconstruction of canine zygomatic defects with 3D printed tissue engineered constructs from autogenous bone marrow stromal cells on beta tricalcium phosphate scaffolds were successful in reconstructing the arch with new bone formation. The risk of implant exposure, especially after radiotherapy, needs to be considered. The use of the stromal cells in a surgical site with persistent cancer cells is contraindicated in cases of people with osteosarcoma because it can promote tumor regrowth. Bone morphogenetic proteins have been utilized successfully. Furthermore, the risk of tissue irritation or suture exposure with radiotherapy is mitigated with this technique. The drawback to the reported technique here in this paper, which is the sling suture technique, compared to the regenerative techniques and plate and wire reconstruction, is that it does not protect the orbit against trauma. The sling suture does not have the inherent robust strength of all the other techniques. Another limitation is the use of non-absorbable material, which has a potential for residual neoplastic disease. So that's the paper there. Obviously, we want to have more cases and longer follow-up, which would be cool. Yeah, pretty neat paper. I like when they try these experimental things. And thanks for you guys for supporting the channel. We'll see you again tomorrow for another one. Take care.